Good afternoon. Thank you for joining us for our Provider Connect Australia Primary Care Information Session. My name is Phoebe James and I'm a Professional Development Officer with the Hunter New England and Central Coast Primary Health Network. Before we begin, I would like to acknowledge the traditional custodians of the lands we are all meeting on today. I am coming to you from Awabakal land here in wonderful Newcastle, and I'd like to pay my respects to elders past, present, and any First Nations people joining us. A little housekeeping, this webinar is being recorded and will be available in the Education Library on the PHN website in the following days. There will be a Q&A session at the end of the presentation. So if you have any questions during, please put them in the question box and we'll get to as many as we can. Now, allow me to introduce Renee Wood, who is Provider Connect Australia lead for the Hunter New England and Central Coast Primary Health Network. Thanks, Renee.
Hi, everyone. Thank you for taking time out of your busy day today to join us. As Phoebe said, I'm the Provider Connect Australia lead for the PHN here. And today we are very lucky to have Julie Curry, who is the Senior Project Manager at the Australian Digital Health Agency, as our guest speaker today. So Provider Connect Australia is a service operated by the Australian Digital Health Agency and will change how, as a practice, you update information about healthcare services and practitioners and streamline the way you communicate to your business partners. As you all know, a lot of manual work goes into updating practice details and of general practitioners when they commence working at or leave your practice. Multiple forms need to be completed, duplicating the same information over and over. So as a primary care improvement officer who is out working with general practices, we regularly ask you when we're out seeing you for staffing changes so we can update in our system. So from a PHN perspective, up-to-date information is important for us for disaster management, important communications, grant, education and training opportunities. We are, however, just one of the many providers that need updating. Others include National Health Service Directory, hospitals and diagnostic services, etc. By using this platform to update your nominated business partners all at once, will save you valuable time and free you up to spend on more important work in your practice. It will reduce human error and also ensures there's accurate, up-to-date information available. So today, Julie is going to talk us through the benefits of using Provider Connect Australia, outline the steps required to register for Provider Connect, and describe how to use the Provider Connect Australia portal to make healthcare services updates. So if after the webinar you have any questions or require support, please don't hesitate to reach out to me. But for now, I'm going to hand you over to Julie for her presentation. Thanks, Julie.
Thanks, Renee, and thanks, Phoebe, for having me. Hello, everyone. I can't see you, but look forward to your questions as they're posted in the chat. So as Renee said, I'll be providing some information on Provider Connect Australia itself. Quite a bit of detail around the screenshots and how to actually register, and then some tips and tricks at the end of what to look out for. So just as a reminder, Provider Connect Australia is a initiative of the agency. It is a free tool that was publicly released in 2023 in July, and it's a very young tool, we know that, and we are continuing to make enhancements to it as we understand more about what users need and how they interact with PCA. We are very much focused on its rollout at the moment, and as well as general practice and pharmacy. Allied health is a key area for us that we're focusing on, and we actually do have the Australian Podiatry Association now on board as a business partner to PCA, and we're hoping that list of business partners will continue to grow. So what it does actually aim to connect providers, healthcare providers, with their business partners. And a business partner is really anyone that you work with or interact with that you need to share information with. The aim of it is to streamline registration and any ongoing updates you need to make to enable to enable healthcare providers to maintain the information in a single place. It does support the agency's digital health operability and interoperability plan. So it does support our strategy as well as the newly released National Digital Health Strategy. And by doing so, it kind of aims to create improved system integration, allowing for a foundation for a better connected healthcare system. Why did we develop PCA? We know that healthcare providers and organisations need to share and maintain their data with a number of business partners to support how you provide your service, how you deliver your service. And like I said previously, a business partner is an organisation, any organisation that needs to receive information from you to support the services you provide. And so, as this slide indicates, it can be directories, it can be funders, it can be hospitals, it can be your PHN, it can be online booking systems, etc. We know that registering with these partners and keeping them updated with changes can be a significant red tape burden for most of you. So every time, for example, a practitioner joins or leaves a service, it can require up to 10 to 15 different forms asking for the same information to be completed. And so this means that you could miss providing updates, it could be out of date, you could potentially make errors or transcription errors. It could be a barrier. If you're trying to implement a new system, it could be a barrier because it's another form to complete, which kind of hampers things. And so that's why Provider Connect Australia was developed. It aims to reduce all of those red tape burdens by capturing information around your organisation and your practitioner service information and practitioners themselves in one central location that you then would push out to the various business partners that you nominate to through the portal. We do have 35 business partners on board at the moment, and we are obviously hoping to extend that. So the more business partners that are on board, the more that you can share your information at once. And through the portal, you would be prompted to update certain information, submit it, and then there's a verification process that happens behind the scene. The Healthcare Identifier Service, AHPRA registration, Business Registry and Medicare are some of the validation sources. So there is an assurance that there is validation that has occurred around what data has been entered. And then you can share that with your business partners all at once. So you don't have to complete the forms over and over and over again. And like I said, we have the Australian Podiatry Association who's recently joined, and we're having conversations with many private health insurers at the moment and other kind of sector partners to hopefully expand that list of business partners. So I'll take you through some of the detail now, and this is what the PCA portal login page looks like. You can also connect to PCA through PRODA, which I'm sure you would know is managed by Services Australia. So you will need to make sure you have a PRODA login as well. It works through your browser, so if you can't log on, then just try a different browser, clear your cache, or keep your profile current. So the first step you'll need to complete is to actually register your organisation. At the moment, PCA requires a relationship between the organisation and the practitioner. So hence you need to register your organisation first. And these are the key steps to register your organisation, which I will take you through in more detail. So you can set up Helper in the PCA portal pop-up to help guide you, which is a good tool. So if you are using Proto to log into PCA, one of the big advantages by doing so is that some of the information can be pulled from Proto, and so it pre-fills PCA. It can also allow you to search for your practice's ABN, and then you enter the details and your organisation now exists in PCA. This next step around signing participation agreements is really important. So the PCA organisation manager, so that's who you would nominate to kind of manage and own updates in PCA, would need to get 2 documents executed by whoever is usually the practice owner or delegated authority or director of the practice first. So the first document to complete is the participation agreement, which can be signed electronically by the practice's authorised representative. And then the second document to complete is the stat deck, and the stat deck is pre-filled with PCA data and pretty much states that the person executing the agreement is an authorised representative of the practice. Once it's witnessed, then you upload this into PCA. You'll also get these documents via an email workflow. This is the electronic signature screen. So you don't need Adobe software, just your browser is fine. And the next step is to submit this information for verification by the agency. It usually takes about 24 to 48 hours to complete this process, and you'll be notified by email when it's finished. So this screen shows the documents have been approved now. After you get the email confirming the application has been approved, you go back into the PCA portal to complete your updates. In this step, you retrieve your organisation's healthcare identifier data, which is retrieved through Proto. Now you need to enter your organisation's kind of location details and opening hours. Some common issues we've found here is that you get, our team gets asked is that if there is multiple locations, can they be entered? And yes, the answer to that is yes. And we actually encourage multiple locations to be added. So you've done your organisation updates and added those details. Now it's on to healthcare services themselves. And these are the services provided by your practice. For example, it could be a vaccination service, it could be chronic disease management, it could be anything else that your service provides. And by listing them here, that service level information can be also shared with your business partners or directory services when you're ready to publish that. The National Health Services Directory managed by Health Direct also has the ability in PCA for you to import your list of healthcare services, which can make it easier, I guess, to update. But if you don't do it that way, you can also do it manually, which is this screen here. So you add your services at the location level, and you can have multiple services at one location. This slide here just shows an example of a general practice that's been added to PCA. So please, when you are kind of going through these stages, make sure that the information is correct that has been added. You can see on that screenshot as well that there is the National Health Services Directory identifier number. When you import service types from National Health Services Directory, the ID should be attached already. But if you can't see it, then you need to search for the identifier by using state postcode service type, for example, and then you can proceed from there. Once locations and healthcare services have been added, The Setup Helper wizard will prompt you to complete the remaining steps. And that is to add your organisation's practitioners to PCA. So in the pop-up window, you can enter search criteria to find your practitioners. For example, you can enter the practitioner's first name, last name, and click Find Practitioner. This will search the AHPRA database and present you with a set of results. Once you've found your practitioner, you click Add. Next, you can update practitioner details such as the preferred name, as well as when they started and potentially ended working at your practice. You can also set the start date for some time in the future. So if you have, I guess, someone coming on board but not yet started when you make your updates to PCA, you can set their start date for the future. It will mean that their status in PCA is inactive until the date is actually ready. So then you can choose the practitioner's role type at the healthcare service by selecting from the drop-down menu or entering a specific role type. PCA also has the ability to capture languages spoken or whether a service is provided by telehealth or remotely. So you can add also relevant identifiers for your practitioner, such as a Medicare provider number, which you just select validate Medicare provider number before proceeding. Or you can choose another option, and that is to add the details manually. So if your practitioner, for example, is not registered to AHPRA, there is a manual process for adding that to PCA. So this slide shows that the healthcare practitioner has now been added. And then the final step really is to publish that information to the business partners that you've selected to publish them to. So by default, practitioner details will be published to the National Health Services Directory if you select that. For healthcare software providers and consumers to know, I guess, more about the service that you provide. You will need to confirm the practitioner has consented to the provision of their professional information. So usually there is kind of a data kind of agreement or document that a business partner would work with you on to ensure the sharing of data is consensual. And here is the information that's being confirmed that is about to be sent to your business partners. And then a screenshot to show it's being published. So once your practice information is in PCA, updating it is a much easier process. You just click on the relevant plus button and you can complete your updates from there. So just please note that the relevant healthcare identifier number will normally show in real PCA. These are just some mock screen ups that we've included. So that is a lot of information that I've just kind of very quickly taken you through. And there is a lot of support available, and the first point of call should be the PCA website. Here are some common questions I guess we come across. The first one being, how do PRODA and PCA work together? You can connect to PCA through PRODA, as I've mentioned. PRODA is a master key, I guess, to all federal government health information and other information. And as you know, it's owned by Services Australia. And so to make PCA, to kind of maximise PCA and make it work correctly, you will need a PRODA login. Who can sign the participation agreement and authority documents? It's the nominated users. So the owner or owners of the practice nominate who that authorised representative is, and then this person then manages the data in PRODA and PCA. Next question is around what if your nominated user no longer works here? How can we update PCA? And so you will need to actually contact us if your authorised representative does change. Is there an easy way to import my organisation's data into PCA? Yes, there are a few ways to set up your organisation in PCA to minimise your admin overhead. And that is by importing your healthcare identifier organisation data from HPOS, importing, if you've used the National Health Services Directory to share information, you can import that via PCA. And you can also, this is optional, add or update subsidiary organisation information using the Australian Business Registry. And this option is usually reserved for much larger organisations where this kind of structure exists. Why do I need to enter bank account details? You don't. This is not mandatory, it is optional. But this feature was added just recently to allow healthcare providers the option to share their bank details specifically with funders, private health insurers, for example. Final question is around what integration options do you offer with My Clinical Systems? So at the moment, unfortunately, PCA hasn't integrated with any clinical information software systems, but we do know that that's something really important. We are working on that at the moment, meeting with a few of the big vendors on how we progress that. So this slide is just really there to show you where you can get more information and support. For any PRODA queries, we encourage you to contact Services Australia. But for any queries related to PCA itself, feel free to contact us. We're also happy to hear about your experience and if you have any concerns or opportunities for improvement. Thank you.
Thank you, Julie. That was really, really informational. We haven't had any questions come through. I do implore everyone attending to please send through your questions while we do have Julie online. It can be really beneficial to get this interaction with any questions that you may have, any experiences you have with using PCA. Julie, thank you. Really, really good. Renee, did you have any questions from the presentation? Jack has just sent through a question. Yes, this is being recorded, and I'm more than happy to send out the link. This recording will be in our education library on the PHN website in the coming week. And it will also have the Julie's presentation in a PDF format as well. So I'm going to take the lack of questions as a compliment to Julie's thorough presentation. Thank you to everyone attending. We really do appreciate you taking time out of your day to support these sessions that we put on. Thank you to Renee for helping organise, and a huge thank you to Julie for the presentation. It takes a lot of time to put these things together, so I just wanted to say thank you. And I do have Julie, are you there? Maybe
I am. Yes, baby.
Oh,
yes.
Sorry, it just disappeared. I just have one question that's come through. It's PRODA was cumbersome to enter My Medicare as an organisation. How user-friendly is it with PCA?
Yes, unfortunately, we can't influence the PRODA way it works, I guess. But once you do have your information in PRODA, importing that into PCA is easy. So yes, acknowledge it can be clunky to kind of set yourself up in Proda, but once it's there, it's just a matter of importing the information over.
Sure.
Yeah.
Perfect. Rhonda, thank you. Thank you. Okay, well that's it from us. Thank you so much. We will gift you back the 30 minutes that we are running early, and look after yourselves. Thank you again.
Thanks, Julie.